This chapter is going to cover communication and how to do interviews in the clinical setting. This can also help you with other patients, not only mental health patients, but your other patients that you come in contact with. And of course, patients on the medical units and offices also too have mental issues. So this should help you all the way around. Remember, when we think about communication, this is how we give information. We receive information, so there's a sender, there's a message. And remember, the sender is the one who initiates the contact, and then you have your message. And this can be either sent or expressed, either validating the message, the sender's message, which is very important. Media is if either you hear it, see it, touch it, or smell it. And then feedback indicates if the receiver is accurate in interpreting what that message was that was sent to them. Here's a little case study for you to look at. It's about a new nurse on a psych unit who wants to communicate effectively using setting up a therapeutic relationship with the patient. What are some things that will help with this communication? So again, it's knowing what message you want to convey to that person. What is the purpose of your message? And make sure you tell them what was really meant. Make sure you are very clear. And then comprehend the meaning of what the patient is initially or unintentionally giving to you, either verbally or nonverbal communication. Remember, here in your case study, it tells you that communication should include clarity and continuity. Meaning clarity, make sure your message is accurate and both parties understand what is being said, and also make sure that everyone is a part of that communication process. Continuity, this is the connection between ideas and feelings and the events and things conveyed in the ideas that were sent. We have a lot of factors that are involved with communication. So personal, this could be emotional, social, cognitive factors, which can actually even hinder accurate transmission of the information or the interpretation of the message. So we have to be very careful with that. Environmental factors, again, these are the physical and the societal factors that are out there. If you're in pain, are you really going to comprehend what somebody's telling you while you're hurting? Relationship, this is the status of the individuals. What is the social status? Is there power struggle going on there, an age difference, success? And sometimes this can actually be on an unconscious level. When it comes to verbal communication, this is, of course, what is being spoken. So, and verbal communication can communicate beliefs and values, perceptions and meanings. And then it can convey interest and understanding. There can be insult and judgment can be conveyed. Clear or conflicting messages can be sent. Someone can be honest or have distorted feelings. Clarifying certain words can be very important depending on how they are culturally perceived. Then we have your nonverbal communication. How you say it and what is the real message that is being sent. On page 150 in your textbook, there's a table that you can look at. I think that would be helpful. The eyes and mouth give away true meanings. Messages can seem to mean one thing and really say something else. So think about the different cultures and also in how they communicate. Remember, we can get doubled or mixed messages, and that can be found on page 151. Here's a little bit about therapeutic communication techniques and some tools that can be used to enhance communication. Using silence. This allows for thoughts and feelings to be explored before sharing. It's a time of reflection. Sometimes someone may use prompting if there's this extreme amount of time of silence. Active listening, this is where you're going to observe nonverbals. It's going to allow for understanding and reflection of a verbal message. You can also look for inconsistencies. This can strengthen someone's ability to solve problems by letting them know that they are not alone. And then listening with empathy, that's your understanding, and really taking the time. A good thing to always do is to make sure you're using clarification. So clarifying, this is requesting some kind of feedback on your accuracy of understanding what's been said. And then questions, this elaborates or helps to correct any kind of misperceptions. There's also a little video that you can look at, and you can see that on your regular PowerPoint. But go ahead and think about how you listen, and when you're talking to someone, when there's a sense of silence. And sometimes this makes us feel uncomfortable because sometimes we feel like we need to fill that void. But lots of times it's good. It gives that time for that reflection. There's some clarifying techniques that can be used as well, and they're listed here, such as paraphrasing. Paraphrasing is just repeating back what they said in your own words and how you understood what it was they were saying. When you're restating is usually done in less words that were originally given in the message. Then you're going to validate through restating or confirming, or they can deny that, no, that's not what I meant. A nurse can mirror a message and repeat the same keywords the person spoke, but make sure you don't use this too much. But that's the restating and reflecting, actually. To help the patient better understand their thoughts and feelings, a question or statement that conveys your observation can help, and sometimes when this is shared, it shows acceptance and that you can gain their full attention. An example of this is actually on page 153. Also, you want to examine ideas, experiences, use those open-ended questions. Tell me about, or tell me how, or describe. A closed-ended, of course, is going to be your yes or no. What ifs allows for someone to have some expression. And then when you have suppose you type of statements, motivates them to pursue something or to helps you to get to something more important. Maybe there's a point you're wanting to make, so maybe you're trying to get them to that certain point of the conversation. When we're asking questions and trying to get a response, again, remember your open-ended questions actually encourages them to share information, and your closed-ended questions are a yes or no response. Some of your non-therapeutic techniques can be excessive questioning, and your patient can start to feel overwhelmed, like you're interrogating them, and they feel like you're being very demanding of them. When you're given approval or disapproval, lots of time our patients are looking for approval. So, so if they get this, they're trying, are they coming to a conclusion of their own conviction or volition, or is it because they're saying something because they want your approval? And disapproval usually makes a patient lots of times feel like they're being judged. When it comes to giving advice, this can interfere with their own decision making. This can, by making suggestions or alternatives, we can list those, and then they can choose which ones they want. So you can, say, well, you could have this option, you already have this option or this option, and then they choose. So you're not actually telling them what to do. Asking why question, this implies that they're doing something wrong. It demands that you give them that they give you an explanation. So a patient can become very defensive if you keep asking them why and why and why. Kind of reminds me of a 3-year-old or a 4-year-old that asks you why all the time. And so you can see a nice table on page 156, table 9-3, for some more examples. As we mentioned in a previous chapter, I think it was chapter 5, cultural considerations, so communication styles. And some cultures are very dramatic when they communicate, and others are very calm. Eye contact may be present or absent. Touch may be private or may be invasive. Cultural filters. This lots of times we form a bias or prejudice, and this can interfere with what we pay attention to. So you need to make sure you're not over, reacting because someone won't look at you. You need to take those filters off and make sure that you're being respectful, but don't stare someone down if they're not giving you that eye contact, because that will make them feel very uncomfortable and you'll cut off that communication. When you prepare for that interview, one of the things we have to think of is the pace. And we always let the patient set the pace. Also, we have different settings, maybe in a home, a clinic, or an office. And you want it to be where both parties feel safe. Also, too, should be non-threatening area. So, again, you want to think about your seating. Such as levels. The interviewer should not be sitting up taller or at a larger desk hovering over the client or the patient, because it makes them feel vulnerable and like you have superiority. So you want to be at the same level when you're talking with them. Also, too, you want to be at a safe distance, and you also want to be where there's a easy exit out of the setting. For introductions, who, purpose of the meeting, time, you want to cover the issues of confidentiality, so all that's going to be introduced in that initial meeting. When you're initiating the interviews, again, use those open-ended questions or make a statement in which way you're going, and make sure that client feels comfortable. They say when you have attending behaviors, this is usually the foundation of your interview. So you have the eye contact. You want to hold more contact when a patient speaks and less when the nurse speaks. So as they're speaking to you, you make sure you give more eye contact at that point. When you're speaking, make sure to look down, look away, but don't stare them down, because it's like you're demanding of them, or that you're superior or getting on to them. Body language, again, you need to think about body language. It should be relaxed, not closed off with arms crossed, legs crossed, that type of body language. And on page 61, they do give you some examples. Your vocal quality, in other words, how you say it. And how you say something one way and then say it another can give off two different complete meanings. So you have to say, you want to think about, I will see you tonight, versus, or I will see you tonight, meaning I will see you tonight, and the other is more threatening kind of situation. So meaning like, is tonight the right night? And when you emphasize you, it kind of says that I want to see you. And that can go in a couple of different ways, actually. So, again, pay attention to those two pages, page 161 for body language and page 162 for vocal quality. When you think about clinical supervision, this fosters professional growth and helps to minimize the development of a non-therapeutic nurse-patient relationship. This really refers to your IPR, and it's a tool for identifying how communication is given, and you're doing those in your clinical mental health rotation. Excuse me. So is this written record of a segment of your nurse-patient session that's going to reflect as closely as possible the verbal and nonverbal behaviors of both the patient and the nurse. Okay, I'm going to let you try answering this question. And here's the last one.